All right, so I briefly wanted to go over foam rolling with you if you are having any kind of hip pain. Foam rolling can be really great. So the first muscle we want to pay attention to is your TFL, your tensor fasciae latae. It's going to be on the side of your hip. So we don't want to be on the bursa itself. We don't want to be on the bone. So we just want to make sure that we're in the right positioning. And you'll feel this almost as soon as you get onto it, most likely. Go ahead down to your elbow. That's where I find the most comfort. I'm already on it. Ooh, it feels good. So you're just going to be on the lateral aspect of your hip. In between the hip bone and the femur itself. So it's a smaller chunk of area. So we're not going quite down the IT band. So from here, you can just rotate over onto your butt. And I would just, let's see, if we want to do the right side, you're going to cross your right leg over your left knee. And then we can do your glutes, piriformis, a little bit in here. I'm sorry, I worked out yesterday, so I feel pretty good. Ooh, feels good. You can kind of move your body to where you feel like you need it. If you want to go onto your elbow, you're welcome to sink down onto your hand, whatever feels comfortable. But we want to roll out piriformis, the glutes. This is going to get TFL. And if you want to turn over onto your quad, you're welcome to do that. Just for purposes, I'm going to switch sides. So you can start up by your hip bone, and then just see if you have any hip flexor, a little bit of tightness there, and then just start rolling down the quad. If you're tight on the quad, bending that leg, ooh, gets that quad so good. So you can go all the way down to the top of the knee, which can also be very spicy. Now, if we want to do the lateral leg down the IT band, you're going to start just below this area. We don't want to go on the bursa sac, okay? So right where the femur bone is, you can kind of feel where the bone is. You want to go just below it, okay? So think like bottom of your butt cheek. And I'm just going to angle it for purposes, but again, I come down to my elbow, and then you can straighten out this leg and keep it bent. Ugh, spicy. So find those spicy spots, kind of roll into it. You can go all the way to above the knee. So you want to stop before you get to the knee joint. Another muscle group is going to be the inner thigh. All right. So what you're going to want to do is you're going to want to angle the foam roller with the leg that you're going towards. So if it's your right leg, you're angling it to the right. You're going to kind of bring your body and straddle over it. So where this is right in that hip groin crease. Ooh. And then you can roll kind of back and forth on this. You can move it slightly down the leg. Straighten the leg, bend the leg. You can do internal, external rotation by lifting your foot up and down. You can roll back and forth. It hurts so good. Definitely is going to feel some feels. So if you have a foam roller, get it out, okay? Start mobilizing the muscles so you have improved range of motion. So when you do your strengthening, you then can maintain that range of motion. So foam rolling is so great. You can do it for posture. You can do your back. There's a lats. You can do the sides. So foam rolling can be really excellent. So these are my favorite pelvic foam rolling exercises. So add these into your routine.